Welcome to the deep dive. Today, well, we're looking closely at something often missed. What it's actually like to live with adult ADHD.
Right. We usually hear about it with kids, don't we?
Exactly. But the experience for adults, that can be quite different and, frankly, often overlooked.
Yeah, and we've got a really interesting study to guide us here. It's from the Irish Journal of Psychological Medicine back in 2017.
Oh,
It's qualitative research done in Western Ireland. They did these in-depth, semi-structured interviews with 11 adults diagnosed with ADHD. So it's not just numbers.
11 people sharing their stories. That's so valuable because, yeah, a lot of research is more quantitative, isn't it?
It is. It gives us a look into their day-to-day reality.
So our mission today really is to pull out those key human insights. What are the specific challenges? Are there any surprising upsides? And what happens when they try to get help?
That's the plan. Really get a feel for the lived reality.
Okay, let's dive in. Where should we start? Maybe with the core difficulties, the symptoms themselves.
Sounds good. The burden of the symptoms was, well, a huge theme. And a big part of that was inattention and just poor concentration.
Right. Things you might not even think about.
Exactly.
Mm.
Participants talked about struggling with everyday things, reading, watching TV, even writing something coherent, remembering things too.
Right.
One person literally said, I try watching and learning new things, but I just don't have the concentration for it like others would.
Wow. That's quite direct. And it slows things down.
Definitely. Another mentioned, it would probably take me longer to complete a task than the average person,
Yeah.
just because of that focus issue.
And in college, I imagine that's amplified.
Absolutely. We heard someone mention feeling behind in college, specifically because they couldn't concentrate like they felt others could. It's this constant struggle, you know?
Yeah, like you're always playing catch up. It's not just about paying attention, is it? It's about managing it.
Precisely.
Right.
Regulating focus, filtering distractions. It's like this invisible effort they're constantly making.
Okay, so that's inattention. What about the H in ADHD, the hyperactivity and impulsivity?
Right. And interestingly, it wasn't always the classic bouncing off the walls image.
Hmm.
One participant put it really well. Wouldn't outwardly be hyperactive, but I might find it very hard to be concentrating on a single clear thought. My mind would be racing and tumbling after itself.
A hyperactive mind.
Yeah.
That makes sense. Constant mental chatter.
Exactly. But the outward impulsivity was definitely there too. Blurting things out, not having that filter sometimes.
Yeah, saying things without thinking.
And struggling to finish things. That feeling of getting, say, 80% done and then poof, on to the next thing.
I think many people can relate to starting projects.
For sure. But this seemed more pervasive, like starting to paint the garden fence, then suddenly deciding the shed needs doing right now and leaving the fence half done.
Okay, yeah, that's different. And impulsive spending. Did that come up?
It did. And sometimes with serious consequences. One person talked about spending impulsively and then literally not having money left for food.
Oof. That's tough. So these symptoms, the focus issues, the impulsivity, that racing mind, they obviously have knock-on effects.
Big time. Which leads to another major theme. This sense of limited possibilities, or maybe lost potential.
How did that manifest?
Well, people actively avoided certain paths, like choosing not to do a course or apply for a job because they knew retaining information would be a huge struggle.
So preemptively limiting their options based on the symptoms.
Yeah. One person felt it stopped them pursuing more education they actually wanted, and holding down jobs was a real issue for some.
Why specifically losing focus again? Boredom.
Both. Getting bored easily, especially with repetitive tasks, or just losing focus. One participant described the number of jobs they'd had since their teens as ridiculous. That instability, you know.
It sounds like a frustrating cycle. The symptoms cause problems, which then makes you feel like you can't achieve things, which maybe makes you hesitant to even try next time.
Exactly. And that feeling of knowing you could do better, but struggling to. One person said they felt they weren't working as well as I should be. That creates pressure, procrastination.
And looking back, did they connect this to childhood?
Yeah, some did, remembering being the kid who was always sent out of class or just struggling to make information stick, even if they were trying. Undiagnosed symptoms really impacting their early education.
So the challenges are definitely significant, but you mentioned nuances. Did they see any positive sides to any of this?
Surprisingly, yes. It wasn't all negative. Some participants actually found, well, a kind of enjoyment in their impulsivity sometimes.
Really? How so?
One felt that acting on impulse, spontaneously, often led to better outcomes than when they sat and overthought everything.
Huh. Interesting take. Less analysis paralysis, maybe?
Perhaps. Another person felt their impulsiveness, their unpredictability, actually made them more likable.
Okay.
And even the wandering mind, usually seen as a negative. Someone saw it as a benefit, helping them avoid getting stuck, ruminating too much.
So finding silver linings, it shows some resilience, adapting to how their brain works.
Absolutely. But, of course, the negative impacts were still very real, especially on self-worth.
Ah, yes. Self-confidence and self-esteem. I imagine that takes a hit.
Definitely. A lot of participants talked about a lack of self-confidence holding them back from trying new things, feeling inferior to peers.
Which would make friendships harder too, I guess.
It did, and it limited job prospects. That feeling of I never thought I would be able to do it. Just that core belief.
Where did that come from, do you think, based on the interviews?
A lot traced back to childhood, that constant comparison in school, feeling frustrated or embarrassed when they couldn't keep up or remember things like others seemed to. It leaves a mark.
Yeah, I could see that. And day-to-day life, just managing things.
That was another struggle. Disorganization, feeling overwhelmed by, well, just life admin.
Like what? Chores, planning.
Yeah, household chores, packing a bag for a trip, even making breakfast could feel like this huge, complicated task for some.
That sounds exhausting. It points to those executive function challenges, right? Planning, organizing.
Exactly, those background mental skills we use to just get things done. But importantly, they weren't just overwhelmed, they developed coping mechanisms.
Ah, okay. So how do they cope?
Things like breaking big tasks down, small steps make it less daunting. Writing everything down immediately to fight forgetfulness.
Practical strategies.
Yeah, and sometimes just an acceptance, a sense of, okay, this is how it is, I just have to manage. Finding their own way through it.
Remorseful. But it shouldn't all be on them, right? What about getting external support? Accessing services?
Well, that's where another big hurdle came up. Stigma.
Stigma around mental health generally, or ADHD specifically.
Both, it seems.
Yeah.
There was this resistance reported toward psychiatry, seeing it as a downhill step, almost.
Wow.
And feeling like family didn't understand it the way they might understand a physical illness. Less sympathy, maybe.
And the perception of ADHD itself.
The huge issue was that many people, maybe even the participants themselves, before they learned more, saw ADHD as purely a childhood thing.
Right, the unruly kids stereotype, hyperactive boys usually.
Exactly. Not something adults, especially maybe adults who weren't outwardly hyperactive, could have. This lack of awareness is a massive barrier.
If you don't even know adults can have it, how do you recognize it in yourself or get help?
Precisely. And some mention negative media portrayals,
Yeah.
potentially making that stigma worse.
And people questioning if it's even real. Just an excuse.
That came up too. All of this makes it incredibly hard to seek help or even talk about it, which is a shame because the study found people did benefit from help when they got it.
What kind of help?
Both psychiatry and psychology services seemed beneficial. It really highlighted how important integrated care could be, but the stigma stops people getting to that point.
Okay, so let's try and pull this together. What are the big takeaways from this study?
Well, first, it really underscores that adult ADHD is real, and the symptoms persist, causing significant daily burdens. It's not something people just grow out of.
And that the experience is complex. Impulsivity, for example, wasn't purely negative.
Right. It could be positive sometimes, negative other times. And crucially, the symptoms deeply impact self-perception, feeling different, affecting education, jobs, relationships, leading to lower self-esteem.
And the massive role of stigma. Lack of public understanding is a huge barrier to diagnosis and support.
A huge barrier. Though, on a hopeful note, the finding that combines psychiatric and psychological help works suggests effective support is possible if people can access it.
We should also mention the studies and caveats, right?
Definitely. The researchers were clear. The group was mostly male, Caucasian, all had other co-occurring conditions which might shape their experience.
And they hadn't technically received the formal diagnosis at the time of the interviews, though they screened positive.
Correct. So we need more research with different groups, different stages of diagnosis. But even with those limitations.
It gives us incredibly valuable insights, doesn't it, into the lived reality?
Absolutely. It really paints a picture of the need for more awareness, less stigma, and better support systems.
So, summing up, adult ADHD brings real challenges, some surprising personal upsides sometimes, but it's all heavily compounded by stigma and lack of understanding, which impacts getting help.
It captures it well.
Which leads us to a final thought for you, our listeners. Just consider this. How might things change if we, as a society, had a better understanding of neurodevelopmental conditions like ADHD across the whole lifespan?
Hmm.
What difference could that increased awareness make, not just in reducing that awful stigma, but in actually building support systems that work, that help people unlock their potential throughout their lives?
Yeah, something to really think about.
Definitely something to consider. Thanks for joining us for this deep dive.